Welcome to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with your educational videos about optimal health and the most innovative and holistic approach to your well-being. So today let's take a look how you can heal your Achilles tendon pain with natural and effective therapeutic tools. Achilles tendonitis often affects runners and joggers and athletes, and it's really an overuse problem resulting from too much strain and stress onto the tendons, and that causes these micro tears. So in this video I share with you all the information you need how to tackle this situation successfully. So enjoy this video. To stay updated with more ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and family, and don't forget to click that bell as it notifies you every time I upload a new video. If you're interested in learning more about homeopathy, integrated mental health, health coaching, quantum healing, and so much more, have a look at my website medicanova.net at the online academy, where you will find certified comprehensive home study online courses. And if you're interested in a health consultation, either for yourself or your children, contact me at health@medicanova.net. I'm happy to help here. So what is Achilles tendon pain? Well, Achilles tendon pain is also called Achilles tendonitis. It's the result usually of stiffness or swelling, maybe tearing of the connective tissue located around the heel and the sides of the ankle. So the first signs of Achilles tendonitis is usually this throbbing pain and this tenderness, particularly when you move or you lift your heels off the ground. And the pain is especially on the sides of the tendon around the ankle bone as well as the back of the heel. So tendonitis of the Achilles tendon along with tendinosis, and we'll look at the two different types in a minute, affects, runners, athletes, I mentioned that, but also anybody who spends a lot of time on their feet with other activities. Now studies enlighten us that it's not just overexertion, but also inflammatory conditions within the body, which can add or put an extra strain, literally speaking, onto the Achilles tendon. So you maybe have joint inflexibility or joint stiffness, suffering from weak leg muscles, or joint degeneration in general. Maybe there's arthritis or just wear and tear or just getting old. Whatever it takes, we take it. So the Achilles tendon is considered the biggest and the strongest tendon in the entire body. It carries up to 800 pounds or 400 kilograms. It's amazing, and it's activated when you walk and you climb or you lift your feet in any other way, and it runs down the back of the lower leg, connecting the calf muscle to the heel bone. Now, because this tendon bears such a high amount of body weight and is so frequently used, it's also very susceptible to stress-related injuries. The tendon pain normally develops over some period of time, and these micro tears then form within the damaged connective tissue at the back of the leg. Now, tendonitis of the Achilles tendon very commonly gets aggravated and worse from overexertion or beginning new types of exercises, maybe too quickly, too aggressively, or age-related wear and tear, right, or general degeneration of the tissue. There are two common disorders. One is called Achilles tendonitis and the other one is called Achilles tendinosis. Now, whenever you see a medical label with itis at the end of the name, it means inflammation. So Achilles tendonitis frankly means just inflammation of the Achilles tendon that usually resolves after some time with treatment like ice packs and stretching exercises, rest and all of that. But if it goes more into a degenerative condition where the structure is affected, or there's even a full tear of the tendon, then we talk about tendinosis. And here, of course, you need medical care, but maybe also surgery. There are also two types of Achilles tendonitis. One is called non-insertional Achilles tendonitis, and it affects the middle portion of the tendon. And the other one is called insertional Achilles tendonitis, which affects more the lower portion of the heel where the tendon attaches to the heel bone. So the symptoms, needless to say, are pain. Pain along the back of your foot, pain above your heel, or pain at the sides of the ankle bone. It can be throbbing pain, particularly when you move your heel or your ankle, especially when lifting your heel or standing on your toes. Often people experience the pain after the day of exercising. Definitely we see stiffness, and it's worse in the morning, sort of on awakening. There may be swelling, inflamed tissue. There may be even a thickening, right, of the sort of ankle, or the back of the ankle and the heel area, tenderness, and needless to say, the range of motion in the ankle or heel is very, very limited. Sometimes you hear these unusual noises, maybe a popping sound or this sort of snapping sensation. How do you know you have Achilles tendon pain? Well, if you pinch the back of your ankle and you have this sharp pain, or there's a tenderness, yes, you might be susceptible to that. Or if you stand on your toe and lift your heel 2 to 3 inches off the ground and you have this tenderness, or your calf muscles start to contract, and maybe it's a sign of that. So what are the causes? Well, I mentioned over-exercise, right? Especially without enough stretching. We call it the weekend warriors, you know, the guys who basically work out like crazy at the weekend but do nothing during the week. You know, they're more affected. Or overuse as much as any repetitive activity, right? We have running, climbing, professional dancers even, you know, very much involved here, walking with unsupportive shoes. With athletes, I think it's more the overtraining, that they're not rest enough between the workouts, because it puts just enough stress onto the tendon, because it doesn't give enough space and time to repair the injured tissue. Too much stretching, you know, too many yoga exercises, but too much of everything. Skipping maybe, you know, can affect that as well. And it can lead also to this tight and weak calf muscles. And what happens then, it places a lot of pressure onto the Achilles tendon, and therefore your posture may be affected. So it's good to check that out as well. If you have rigid, inflexible leg muscles or joints, and in this case maybe arthritis or too much of a sedentary lifestyle can add to that too. I mentioned wearing worn-out shoes, but here I want to say the ladies are also, not just the runners are here spoken to, but also the ladies with the high heel with excessive use. Elderly people, needless to say, because there's increased risk of a weakening of the tendons, but also naturally flat arched foot also predisposes a person towards this condition. In general, bone spurs, right? If you have this bony outgrowth developing along the edges of the bone, and particularly the heel, that could be part of it. Certain medical conditions, particularly autoimmune diseases, rheumatoid arthritis, where there's a lot of stiffness and pain involved, maybe psoriasis even, high blood pressure is part of that as well. Certain antibiotics maybe cause it. Usually it's worse in cold weather and wet weather rather than the warm temperatures. And for some reason it affects more men statistically than women, or anybody who is overweight. Right? The weight is really putting a lot of increased risk here. So what's the conventional treatment? Well, if it's diagnosed, you will be suggested to rest your affected limb, you elevate it, ice packs, you know, all, you know, for a whole, quite a long time actually, often 3 to 5 days. You may be suggested a night splint, use of anti-inflammatory medication, and sometimes surgery is needed here, you know, when it gets too much. But before we're going to go into the natural supplements and the homeopathic remedies, I want to share with you some food for thoughts, the metaphysical meaning of Achilles tendon pain. You know, we talked about overexertion. Yes, that is a true cause. But if this happens over and over without you overexertion too much, like you sit in front of the computer and your ankles are hurting always, then I would encourage you to look at your mental emotional stories. Anything what's affecting in your life and causes you stress. Because I think there are some pointers here. Now always look for the metaphysical meaning in the book, The Complete Dictionary of Ailments and Diseases from Jacques Martel. I think he has a very good way how to put it together, the essence of the symptomatology in a few sentences. So he says the Achilles tendon is the longest tendon in the body. It can carry up to 800 pounds and it enables my thoughts and my desires, physical as well as spiritual, to become realities. It also serves to express any blockage on the ankle's movement. For example, I may have a great desire for stabilities, but this is difficult to achieve because of a precarious financial situation. So you get the idea that the Achilles tendon is or symbolizes movement, manifestation, stability, standing with your feet firm on the ground or on this planet, right? It's all about that. So the Achilles heel tendon can support a lot. I do have the impression that I too am supporting a heavy load. It can only be strong and carry a heavy load if its inner basis is solid. But if I feel empty inside, what can I rely on? Maybe I give too much importance to the container, to the external side of things. But what about the content? What about my priorities, my values? What is my life based on? Am I in contact with my divine essence, or am I only at the level of appearance? Is there a breakup in my relations and with others, especially with my children and my parents? Do I always need to move, to go away, as if I couldn't stand to remain in one single place for too long? A bit like a gypsy. I become aware that the Achilles heel tendon works more when I'm in the standing position than when I'm lying down. So you get the idea, right? Manifestation, stability, standing on the ground. So look at your life. Is there anything which really bugs you in relationship to establishing a stable and a safe life for you? So what would be the positive affirmation? I accept to take action to get things moving in order to achieve my dreams and reach the goals I have set for myself, right? Because you want to move, you want to get closer to your dreams. I base my life on solid human values and I increase my inner strength by being myself. So I think it's great food for thought, because we often forget what's really within our mental, emotional and spiritual aura as well, and our beingness and what's bugging us. So what are the natural treatments? Well, on the external side, of course, you want to do rest. You want to bring in a lot of ice packs, as I mentioned before. I would say every 15 to 20 minutes, about every 4 to 6 hours, maybe up to 3 to 5 days. You also want to do some stretching exercises. And I know it hurts, but this tendon needs to sort of heal all these micro tears, and stretching does help, but they need to be very professionally targeted. And in the description box, I put in 2 YouTube links for you with very great and professional guidance, which you should watch and see how you can help your Achilles tendon to heal faster. One is called Achilles Tendon Stretches by Ask Dr. Joe, and the other one is Fix Achilles Tendonitis in 8 Simple Moves, the best exercises for Achilles pain. So have a look at that. I talked about posture correction exercises, physical therapy, because they really help reduce the weakness and the compensation here. Particularly with non-insertional tendonitis, where the middle part of the tendon is affected. Others choose Prolotherapy treatment. It's an injection into the affected area. It's a specific type called PRP, and it uses platelet-derived growth factor expression and stem cell treatment. It sort of kicks off the body's natural repair of the damaged tendon, so that's another possibility. You also want to bring in some supplements to quench the inflammatory condition within your body. And here, always think about turmeric or curcumin as well as ginger. Any inflammatory condition does very well with a lot of omega-3 fatty essential oils. It's really fantastic, from fish oil to walnuts to nuts in general have it, but also collagen. Collagen is not just great for the tendons, but also for the joints and the muscles. And we have several different types of collagen. One is based on bone broth, so it contains glucosamine, chondroitin, and the other one is more bovine collagen. So you want to have a supplement which covers all of that. And because you have this inflammation within your body, you want to bring in antioxidant supplements. Anything will help here. Right? As a turmeric, I also mentioned. Food-wise, you want to have blueberries, you want to have goji berry, acai powder, superfood, all antioxidants, property-filled, wonderful supplements. Here I also would bring in homeopathic remedies, which are truly magnificent here with the combo of the natural supplements, the external stretches, the exercises, the ice application. It really works very well, particularly in the early stages. Why? Because homeopathic remedy reduce the inflammation of the Achilles tendon, but also they prevent the condition from worsening further. You know, the supplements don't do that. It's really just sort of a band-aid to bring down the inflammatory part, where the homeopathic remedy go much, much deeper. They bring about excellent relief in its symptoms, including pain, especially the swelling, the stiffness in the region of the Achilles tendon, and this tight feeling in the calf muscles. Now, among the various homeopathic remedies which we can offer for Achilles tendonitis, there are two top grade ones called Rustox and Ruta, which I will explain in a minute. And they work best when the inflammation of the tendons follows excessive training, right? Straining, over-exercise, stress on the tendons due to its overuse. In case of a tear, right, if we have the tendinosis then of the Achilles tendon, one must, of course, seek help from conventional treatment, and then homeopathic remedy is more a supportive treatment. So in this video, as in all of my videos, I only share with you over-the-counter homeopathic remedies which you can purchase at your local health food store. So nothing too complicated. But the idea here is that you match your individual symptoms of your Achilles tendonitis with the description of the suggested remedy. If there is a match, then the remedy will work. Otherwise, it won't be so magic, with homeopathy. So that's the trick here. The dosage plan for adults, if you get the potency 30, I would say 1 tablet 3 times a day, maybe for 2 or 4 weeks. In more severe cases, you need a higher potency, usually 200. And here you need the advice of a healthcare practitioner. You can contact my practice, medicanova.net or health@medicanova.net for more individual targeted protocols, but also you have to book a session by then. I couldn't do that with an email. So let's talk about the remedies. The one is called Rustox or Toxicodendron. Potency would be 30. It's It's one of the top grade medicines here. And it treats Achilles tendonitis beautifully. When you see the overuse of the tendon, putting a lot of strain on that, the stress, and it helps reduce the inflammation of the tendon, which bring a relief in pain of the tendon. Now the keynote here is the stiffness. That's just Rustox. If you have the stiffness along the back of the foot, the heel, as well on the side of the ankle, the tendons are really sort of, they feel like stiff bones basically, then Rustox will be beautiful. It will work very well, particularly in the morning hours. They also have pain in the heels that is mostly sharp and stitching in nature, and a general relief may be felt by continued motion. Whereas the first movement is bad, right, in the morning, but then continued movement makes it better. If that doesn't help, I would follow it up with the second remedy in line called Ruta graveolens. It's actually made from garden roots, a plant. And here again, we have the tendons are affected from overuse or strain or stress on the tendons. But here you don't have the stiffness so much. It's more the aching, the soreness, the bruised pain in the tendon. Along there maybe is a marked restlessness because it really hurts. So if Rustox doesn't work, then follow it up with Ruta. It's a really nice combo and works very well. If you, on the other hand, experience not the stiffness, not the bruises and the tenderness, but you have this feeling as if the whole tendon is contracted, like really shrunk together and contracted and tense, very tense, Causticum would be a good remedy here, Causticum 30. It's useful where there's a pain in the lower leg. The pain is mostly tearing in nature, so it's not sharp or stitching. And along with that, the Achilles tendon feels very contracted and tense. The heel also feels contracted. And when you have this contraction sensation, the pain is more cramping and tearing rather than sharp and burning. With the contraction, there's another remedy called Cassia Carbonica. I also Calcarb for short. Maybe also indicated more for, fleshy people, more obese people. Again, we see this contracted feeling in the Achilles tendon along with the pain. But here we have also stitching pain in the leg above the ankle as well. And there can also be an attending complaint of pain in the calf muscle. I see that often when people have, or patients come and they maybe have even balance problems and their calf muscles are really tight and really spasmodic, almost cramping. Calcarb is a wonderful remedy, especially even when you touch the calf, it hurts. Good remedy to have. Another remedy when you have this feeling like the pain is worse on any movement, any slight movement, it's Bryonia. Bryonia 30. It's made from white Bryonia or wild hops, and it's best suited when the tendon is painful on any or the slightest movement or motion and increases then the complaint. So Rustox is worse on the first movement, right? And continued movement or motion makes it better. Whereas with Bryonia, every little movement, every little motion hurts. It really gives it away. That's the beauty of homeopathy, because you have very clear keynotes to differentiate the remedies. But with Bryonia, the tendon is also very sore and it's bruised. And there's a marked pain in the heel and tightness again in the calf muscle. But any movement makes it worse. Just remember that. My last remedy is called Chromium or Bic. It's also a great remedy if you have like sinusitis and postnasal drip. Great remedy for that, but that's beside of it. But it's indicated when you have a burning sensation in the heel, right? Very different than from the other remedies. The soreness is worse from walking, of course, because the heel is affected here, along with this pain in the Achilles tendon with a stretched sensation, and aching in the calf muscle is also present. So if you have this burning pain in the heel now, think about Carly Big. Now, homeopathy offers, of course, many more indicated remedy for Achilles tendonitis, such as maybe simicifuga, Ignatia mara, right? Berberis vulgaris, muriatic acid, benzoic acid, and many more remedies. But for the purpose of this video, I want to keep it simple. And as I said, I only talk about the remedies you can get hold of in your local health food store. So with all the simple but very effective suggestions today given, you should be able to stabilize your injured Achilles tendon again. And if you require more help, you know what to do. Contact me at health@medicanova.net or my website medicanova.net. So why not skipping joyfully into your life again? Till next time, much love. Take care.